Let's bring in the doctors. In Montreal, Dr. Christopher Labos is an epidemiologist and cardiologist. In Victoria, Dr. Amy Tan is a family physician and a clinical associate director, professor with the University of British Columbia's Faculty of Medicine. Good to have both of you with us today on the program, and thanks for your time. I'm going to start with you, Dr. Labos, and what you make of this notion that it's time for Canada to get serious and talk about mandatory vaccinations.
Well, it's certainly not a new discussion. It's something that we've talked about. It's just that the political will, and I don't think the public acceptance of it was there up until potentially fairly recently. I think what's happening now with the healthcare system being stretched is, I think, demonstrating to people, number one, how fragile the healthcare system can be and how devastating infectious diseases can be. Most people now watching this show have never lived through a pandemic. They don't have a living memory of what polio used to do to our society. And so the benefits of vaccination seem very abstract to most people, except that now you're seeing what the benefits and what the shortcomings of a non-vaccinated population look like. So the public attitude about this might start to be shifting, which is why I think you're seeing the federal health minister sort of dip a toe very gingerly into this debate and sort of raise the question of, could we start putting something like a vaccine mandate in place?
Yeah, well said. Dr. Tan, weigh in on this, your read on it, because as Dr. Labos is saying, you certainly see anecdotally that there is perhaps a lessening of tolerance going on the part of Canadians who have been double or triple vaxxed now when it comes to people who are unvaccinated.
So yes, I agree. Vaccinations are a very big part of how we manage this pandemic. But I would differ with the minister on a few points, or add to what the minister is saying. I don't think it's the only way or the only thing that we can do right now. We do need to be looking at airborne measures and making sure that people are wearing good fitting masks and looking at ventilation. But bigger than that, and bigger than in our country, we need to be looking at vaccine equity globally, because even if Canadians are vaccinated, if half the world is not vaccinated, variants will continue to occur and they will come to Canada. And so I think we need to not lose sight of the bigger picture here as well.
And Dr. Tan, as a physician, would you support the idea of mandatory vaccinations?
I definitely recommend or support them in very specific places like healthcare and even schools to a certain extent. I think it is, what the public is willing to go with. We need to actually be looking at picking our battles, but also seeing where we can actually educate people. Because a lot of people who aren't getting their vaccines, it's because of known mistrust in the healthcare system. And I think we actually need to build trust rather than use penalties.
Dr. Labos, what about you?
Listen, if somebody asked me to vote on this issue, I would vote yes. I would be in favor of it. Now, the question is, it's very easy for me to say that. There are a lot of legal and constitutional aspects to this. So, I mean, it's all well and good to say this. The question is, how do you formulate the law? How do you draft it? What are the consequences? And so there are many issues to this that go beyond the simple medical aspect of it. I mean, I speak to the medical aspect of it. In a society where everybody's vaccinated versus a society where nobody's vaccinated, the society where everybody is vaccinated does better. Less outbreaks, less strain on the healthcare system. But a lot of the difficulties that are going to be faced in terms of implementing this are going to be not medical ones, but they're going to be legal, constitutional ones and implementation ones as well.
Yeah, well said. All right. And the other thing I'm curious about, Dr. Tan, is what we're starting to see already when it comes to staffing shortages in hospitals, those on the front line, sort of in the here and now. How bad do you think are going to get in your mind, and what can be done to try and mitigate that?
Yeah, I think all of us are holding our breath for this month. We look at each other on the floor and go, how much longer can we sustain being short-staffed and over capacity for beds? Because it's not just furniture. It's actually not about the furniture. It's about the people trained to take care of the patients. And it's not just COVID-19 patients that are feeling the constraints of an overburdened system. Anybody who needs healthcare right now is feeling the effects of being, our hospitals being short-staffed, and all of the resource restrictions are coming from this. So we need to keep that in mind as well. We need to be putting N95s on our healthcare workers. We need to be maximally protecting them from outbreaks so that they're not out with symptoms. We need to be looking at ventilation. These are things that we continue to look at. And I think there's no simple one answer for a very wicked problem. And I think, just trying to create binary solutions is probably not helping us at this point.
And Dr. Labos, here in Montreal, and I know in Quebec, hospitalizations are on a dramatic rise, more than 2,100 people now in hospital. We should point out 50% or so are unvaccinated people, but the idea of the rise in hospitalizations and, of course, inevitably ICU admissions.
Well, I think when you look at the projections that INES, the Quebec Health Agency, has put out, they're saying that within a matter of a couple of weeks, we may run out of hospital capacity for COVID patients. I mean, this is no longer a theoretical question of could we maybe run out of beds? The reality is that if the trend continues as is, it's a matter of weeks before there just won't be any space for people. And then you're going to start doing triage, which is not, nobody wants to do that, but it may come to the point. I think the hope is that the measures that were implemented around Christmas and New Year's are going to start to have an effect, and at least things will level off and maybe things will stabilize. But I mean, this wave has put a significant stress on the healthcare system, and anybody who's still going around and saying that the Omicron variant is a mild variant just has to look at the numbers and realize that that is clearly not the case.
Dr. Christopher Labos in Montreal, Dr. Amy Tan in Victoria. Great to have both of you on the program, and of course we salute all the frontline work both of you do.
Thank you.
Thank you. Take care.